All right, so the next step we're going to do is ataxia. And this is where you are going to want to have the patient, using their unaffected side first, take their finger of their good hand and touch my finger. You want to make the patient reach out. You don't want this back and forth. You want to see how ataxic the patient is. So you have to make them reach for what you're wanting them to do. So take your finger and touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. And it's middle, bed rail, bed rail. Just 3 times and you're done. It's okay to show the patient what you want them to do with this step. So if you have to hold the patient's finger up and say, okay, I want you to touch my finger, touch your nose, touch my finger, and say, okay, now you do it. And then you would do the other side, okay? Sometimes the neurologist will say, skip the affected side, because if you have profound weakness on one side, you cannot score ataxia. So they may say, skip the bad side, which is fine. Just do whatever they ask you to do. Then to do the legs, you want to bend this knee, put your heel of this foot on the knee of the opposite leg, and ask them to run the heel of their foot down their shin to their ankle and back up. And then before you do that, you show them what you want them to do, and then put their leg back in the starting position, the normal position, and say, okay, now you do it. And ask them to do it. So go ahead and do it. Okay? And then we put it back down. And then you would ask her to do it with the other leg. Alright, so that's ataxia. Now we move to sensory. So we have to have a safety pin. You want to open it up, okay, where you can actually only have to hold this part of it. So you're going to tell the patient, first of all, do not tell them you're going to stick them with a pin, okay, because they're going to freak out about that. So you just tell them, I'm going to touch you on both sides of your face. Tell me if it feels the same. That's all you say. You want 3 quick taps. So tap, 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 tap. Does that feel the same? They're either going to say yes or no. If they say no, then you ask the patient, how does it feel different? And if they say it's sharper on the right side than the left, you ask them, okay, the right side is 100%. What percentage do you give the other one? And see if they can answer that question. We move to the arms. If you don't want to be over any bones, you want to be on the meaty part of the arms and legs. So tap, 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 tap. Does that feel the same? Down to the legs again. Tap, 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 tap. Does that feel the same? Another thing you have to keep in mind for your diabetic patients that have like neuropathy, you probably want to be more proximal or up the leg than distal, because if they have neuropathy, the nerve endings are not going to be as good toward the bottom of the foot. So you may want to be up closer to the knee. Next is language or dysarthria. So we use these cards, and they're numbered 1, 2, 3, and 4. So you want to hand the patient the cards if they can hold them, and point to different things on here. So the first one we do is that one.
Hello.
Okay.
Key.
Okay, and so forth. You just point to what's on here and ask them to identify it. The second picture is the one of the ladies washing, or the lady washing dishes, the kids stealing the cookies. Again, ask them to hold it. Tell me what you see in that picture.
Cookie jar fixing to fall, a kid about to fall on a stool, a woman washing dishes, the sink is spilling over.
Okay. And some people ask, why should the patient hold it? Well, if you actually look at the picture and you cut it into quarters, there's 4 different things going on in this picture. And if they are having problems with their vision that the neurologist hasn't clued in on yet, and they're moving this more to one side than the other, or up or down, then that may clue them in that they are having problems with their vision. The next one, number 3, are some sentences. So you ask them to read the sentences for you.
You know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night.
Okay, very good. So if the patient wears glasses and they didn't bring them with them, they can't read anything like that, it is okay to have the patient repeat these back to you. So you may say, okay, I want you to repeat these sentences for me. You know how,
You know how.
and so forth. And then the last one are some words, and they're looking more for how they pronounce these words. So can you say those words for me?
Mama, tip top, 50-50, thanks, Huckleberry, baseball player.
Very good. And then again, if they can't read, you can say the words and have them repeat it back to you. All right, and the last one is extinction. So this is where you want to have the patient close their eyes. I want you to close your eyes. I'm going to touch you on both sides of your face, and I want you to tell me if I'm touching the left side, the right side, or both sides. You want to barely touch.
Left, right, both.
You should not be leaving an indentation in the patient's face, and there's no swiping. It's just light touch. Left, right, both. You do the same with the arms, and you want to make sure they're not peeking, because they'll try to cheat sometimes. Eyes closed.
Left, both, right,
Very good. And then you do their legs. Again, if they're diabetic and they have neuropathy, you may want to be up higher.
right, left, both.
Very good. And you don't have to do right, left, just make sure you hit both of them, and then one time each on each side. And that is all that we have to do for the NIH.